My name is John Clayton. I am a general surgeon here at Mason Health. In that role, I see patients in an acute setting for Mason emergency room and for patients that are admitted to the hospital as inpatients. I also see patients here in Mason Clinic for outpatient surgical issues ranging from hernias of the abdominal wall, gallbladder issues, breast cancer, skin lesions. And we also do a lot of consultations for colon cancer screening. Colon cancer screening has become increasingly important. Colon cancer is currently, for adults under the age of 50, the leading cause of cancer-related deaths in the United States. Colon cancer screening has been lowered from beginning at the age of 50 to now doing at age 45. So in patients who have no family history and no symptoms, they're considered average risk, and we recommend starting colon cancer screening at age 45. For patients that might have above average risk, that would include first-degree relatives with colon cancer or symptoms that are of concern, such as weight loss, anemia, blood with bowel movements. We do screen people earlier than age 45 when appropriate. Colon cancer screening is felt to help reduce the risk of colon cancer-related deaths. And we do know that the earlier you catch colon cancer, if present, the better the outcomes are. People who are diagnosed with an early stage colon cancer have much higher survival rates than people who are diagnosed with more advanced disease. The earlier you catch the colon cancer, the better the outcomes for the patient. In addition to doing a screening exam in asymptomatic patients, when somebody is complaining of bowel habit changes or blood in their stool, a colonoscopy is definitely preferred so that we can help try to diagnose what might be causing those symptoms. Anytime that someone decides that they don't want the colonoscopy and they choose to do a Cologuard test or a Shield test, if that test is positive, the very next step is that you're recommended to have a colonoscopy. In patients who have had prior findings on a colonoscopy, such as polyps or anything that would suggest that they're a little bit above average risk, they are also technically not candidates for Cologuard or Shield because those were designed for average risk patients, not for above average risk. Anyone who's had a history of polyps should continue getting colonoscopies rather than Cologuard or Shield. With the increasing rates of colon cancer in young people, we have lowered the screening age to 45 years old, and that is in patients with no symptoms. And it's important to know that the vast majority of colon cancers that are diagnosed are in people that don't have any symptoms. So it is important to start screening at age 45, even if you feel like you're doing well. In fact, that's the best time to start screening because if we catch it early, you have much better results than someone who waits until they're symptomatic.